everyone, my name is Estu Widyaning Tias. I'm studying in Polytechnic Katolik Mawan Wijaya Semarang, a pharmacy study program. I will try to answer the question from case 20 about acting without prior consent due to an unforeseen medical problem.
Case study 20. Acting without prior consent due to an unforeseen medical problem. When Mr. M, a 52 years old male, was referred to Dr. C, he was in a very serious state. His symptoms included fever, headache, dry tongue, sinus infection, and general septic patienting. Urinalysis indicate his urine was badly infected. He had stones in his bladder and a large stone in his kidney. Dr. C operated on Mr. M in May, draining his bladder and removing the bladder stones. The patient was subsequently treated with injections and his bladder condition improved. He continued to experience severe pain on his left side and had also developed a hernia. A second operation was performed to alleviate the patient's overall physical condition. Several months after the second operation, Mr. M gave his consent to have surgery to repair his hernia. A day or two after the operation, Mr. M was informed by Dr. C that his testicle had also been removed during the surgery due to potential problems it may have caused. In response, Mr. M said he had not given his consent to the removal of his testicle and had never been informed that it might be necessary. Three eminent surgeons supported the correctness of Dr. C's procedure. They state that no surgeon could have anticipated the condition and that further surgery had been necessary. The question is, should Dr. C have postponed the operation until Mr. M was able to give his consent? No, removal of the testicle was a necessary part of the operation to repair the hernia. The need to remove the testicle could not have reasonably be ascertained before any surgery was undertaken, and consent for further surgery was implied in Mr. M's request to repair the hernia. And then yes, Mr. M did not give his consent to the removal of his testicle. Under these circumstances, a testicle can be surgically removed only if the procedure is considered an emergency or life-saving procedure. If it does not constitute an emergency, the physician must postpone the procedure until the patient gives his consent. In this case, however, it must be assumed that the condition of the patient's testicle was not considered to be so serious as to immediately endanger the patient's life or health, and that there was reasonable opportunity to obtain the patient's consent for surgical removal of the testicle.
And in my opinion, the hernia is a condition when tissues and organ in the body protrude out through muscle tissue that is not strong enough to support. This condition usually cannot on its own and can get worse over time. Therefore, doctors often recommend surgery to handle it. But not all hernias requires immediate surgery. The step in the treatment of a heel will depend on the size and symptoms felt by the patient. In hernia not causing complaints, surgery may not be needed. However, hernia usually cannot heal by themselves and can get worse over time. Therefore, medical treatment should be done. Doctors will generally recommend surgery on all forms of hernia. This procedure is especially recommended for patients with conditions such as hernia that have trigger pain, discomfort, or continue to enlarge over time. This is my opinion. May be useful. Bye bye.